Acetaminophen, a deadly dosage. In 1999, shortly before Christmas, Davy Baumel got a sore throat. His parents gave him maximum strength Tylenol sore throat for a week, hoping he would be better by Christmas. However, he did not get better. On Christmas Day, Davy started throwing up blood, and his dad took him to the local emergency room. A few days later, he was declared brain dead and later died, all in the span of 2 weeks. He was only 12 years old. The reason for Davy's death was not due to his sore throat, but instead because he inadvertently overdosed on acetaminophen, the active ingredient in Tylenol. Neither of his parents realized that Tylenol could cause their son's death. Sadly, Davy is not alone. From 2001 to 2010, 1,567 people died from inadvertent acetaminophen overdose. What's more is that an estimated 78,000 Americans go to the emergency room each year due to overdosing on acetaminophen. In January of 2003, 5-month-old Brianna Hutto came down with a fever and a cold. Her parents were instructed to give her infants Tylenol, and after giving Brianna the recommended dosage every 4 hours, her condition worsened. Her parents took her to an emergency room, and 5 days later, Brianna died of liver failure. Her parents also had unknowingly overdosed her on acetaminophen. One of the main questions that arises in these cases is how can a drug that is used by over 100 million Americans each year in roughly 29 billion doses cause such serious health problems? In fact, a poll done by ProPublica found that 51% of respondents were unaware of any safety warnings associated with Tylenol. The problem with acetaminophen is because according to data from the FDA, as little as a 1-gram increase, equivalent to 2 extra-strength pills, from the maximum recommended daily dosage of 4 grams could cause acute liver failure in consumers. What this means is one small error in dosage could have potentially fatal results. The difference is as small as overfilling a liquid Tylenol cup by a few milliliters a handful of times over the course of a week. Acetaminophen is the leading cause of acute liver failure in the United States at 46% of cases, and in many of these instances, the only cure is a liver transplant. In April of 1995, Marcus Trunk suffered a sprained wrist and was prescribed acetaminophen by the family physician. He soon purchased an over-the-counter acetaminophen product when the prescription was finished because he continued to have some pain. A few weeks later, Marcus stopped eating because he thought he had the flu. However, his flu-like symptoms were actually caused by acetaminophen toxicity. He was unknowingly intensifying the toxicity by fasting. 2 days later, Marcus went to the hospital and was placed on the organ donor list. Without a liver donor available, he passed away. The bottom line is that one of the side effects of a common household painkiller should never be death. Consumers need to be aware of the potential dangers of inadvertently overdosing on Tylenol and other acetaminophen-containing products. It is important to remember that acetaminophen is a useful product. It just needs to be taken with caution. Consumers need to be aware that it can be extremely dangerous to take acetaminophen with alcohol, while fasting, with another acetaminophen product, or even just a small amount over the recommended daily dosage. No parent should ever have to watch their child pass away, especially when it's caused by a mild pain reliever.